In Uganda, malaria is the leading cause of illness and medical visits. Because the vast majority of cases, 97%, are caused by the Plasmodium falciparum parasite, the most dangerous strain, symptoms can progress from mild to life-threatening very quickly. If you are in Uganda and feel unwell, it is standard medical advice to assume it could be malaria until proven otherwise by a test. Symptoms typically appear 10 to 15 days after a mosquito bite. The malaria paroxysm often starts with a cold phase, shivering, followed by a hot phase, high fever, and finally a sweating phase. High fever, often intermittent or spiky. Chills and shivering, known locally as shaking. Intense headache, usually feels like a heavy pressure or throbbing. General body weakness, feeling heavy or having no energy, or what we call malaise. Joint and muscle pain, common bone-shaking aches. Nausea and vomiting, especially common in children. Loss of appetite, a very common early sign in all ages. Severe danger signs that will require seeking for emergency care. If left untreated for even 24 hours, P. falciparum can cause organ failure. Watch for these critical symptoms. Convulsions or seizures, often a sign of cerebral malaria. Extreme drowsiness or confusion, difficulty waking up or knowing where they are. Difficulty breathing, fast breathing or panting for air. Yellowing of eyes, skin, known as jaundice, indicating liver stress. Dark or Coca-Cola colored urine, a sign of black water fever, red blood cell breakdown. Inability to sit or stand, total physical exhaustion, prostration. Symptoms in children and pregnant women. These groups are at the highest risk and may show different or more subtle signs. Infants and children. Refusal to breastfeed or eat, constant crying and vomiting every time they eat, or very pale palms and tongue or anemia. Pregnant women. Severe anemia or feeling dizzy, fainting, high fever, and reduced movement of the baby. It's important to test, don't guess, because malaria symptoms often mimic the flu, a common cold, or a stomach bug. You should get a rapid diagnostic test or a blood smear at a clinic immediately if a fever occurs. Stay subscribed to Health Next and don't forget to hit a thumbs up if this video was helpful to you.